panel, we're going to have some quick to and fro with some practical questions here, and really try to tease out the links that have been going, and with a focus on what works or not, who can make the difference, and how are we going to get mindset and behavior change to get results at scale. So I'm going to start, first of all, with Cristina Romanelli, who's obediently sitting next to me. And she works for the Secretariat of the Convention on Biological Diversity, as you've heard, and brings us a global perspective on the planet's life support systems. Now, Cristina, you lead on the biodiversity and health interface and are very familiar with the current state of evidence globally and the economic benefits. How did that come about?
Well, actually, it's something that both Dr. Neda, whose leadership I very much would like to thank, and Dr. Zhang have alluded to. So it actually came about in 2012 when at our Conference of the Parties there was a call for the creation of a joint work program between the CBD Secretariat and the World Health Organization. So from that time, we've engaged very actively in building capacity and also in trying to bring together the scientific knowledge at the intersection of biodiversity, ecosystem conservation, and human health. Because this knowledge, this scientific knowledge does exist, but is not readily accessible to policymakers, decision makers that are often faced with these day-to-day planning decisions. So under the leadership of the WHO, we have co-convened a group of experts, over 100 experts, in a variety of thematic areas, so ranging from air and water quality, agrobiodiversity, food and nutrition security, infectious diseases, non-communicable diseases, microbial diversity, biomedical discovery, but also traditional medicine, which often gets neglected in this discourse. And of course, cross-cutting themes such as mental health, social and cultural well-being, and of course, climate change and disaster risk reduction. So this was a 2-year process, and some of the, it's a 365-page volume that's condensed with, replete with very, very important scientific information. And it not only draws on scientific data to demonstrate that biodiversity continues to be lost at unprecedented rates. So, for example, over 1/3 of vertebrate species have been in decline between 1970 and 2006 alone. And birds and mammals that are essential to food and nutrition security and to the development of medicines are at greater risk of extinction. So why? Why should we care? Why should this public health community here care? Well, as Dr. Nera has indicated earlier, over one quarter of the global disease burden is attributable to modifiable environmental factors. This is not insignificant. So we're not only really worrying about the intrinsic value of biodiversity, but also because the provisioning, the regulating, the cultural ecosystem services that sustain human health are being degraded at unprecedented rates. And 2/3 of the ecosystem services that have been evaluated are estimated at being lost, with tremendous repercussions for human health. So often when we think of human health outcomes, when we try to address human health outcomes, the public health sector has traditionally tended to be, and you may correct me on this, responsive rather than preemptive. So it has focused on responsive measures, focusing on following a health crisis, if you will. But we forget that biodiversity loss, and ill health share many of the same drivers. So, for example, land use change is the leading driver of disease emergence. Overexploitation and destructive harvest threaten the food security and nutrition of millions of people worldwide. Pollution, which Maria and Dr. Zhang have alluded to, contributes to an enormous proportion of respiratory diseases, but also bioaccumulation in the food chain. So what Connecting Global Priorities does, and this is of course not the full volume, but just a very short summary of its key messages, launched incidentally at the 14th World Congress on Public Health, so there's great continuity here. So what this does is says there are a tremendous amount of linkages, and between sectors we really need to be looking at what brings these things together rather than what divides these sectors.
Okay, excellent. So you've indicated what we need to expand understanding and action. I'd like to turn to Matthew Jackson, who is the relatively new CEO of Parks Victoria, coming from a background, I believe, in nature-based tourism for part of your background. So Matthew, we've heard a lot of celebrating Parks Victoria having been a true first mover in this area. It would be great to hear a little about both the partnerships, but also the recent research on valuing Victoria's park, the key findings that help you and your partners use the data for change.
Absolutely, and firstly, can I acknowledge everybody coming to the session today. We're delighted to have you all here in the esteemed panel, and today was a milestone. If I can talk about 15 years of history with Parks Victoria launching Healthy Parks, Healthy People, to have our Environment Minister and the Health Minister, and as the President said, a unique situation to launch an environment plan in health. Talking to the health sector is aspirational, and we're honoured and delighted that that's happened in our vision. I think from our point of view, if you look at Parks Victoria, we are very clear and were very clear back in 2000 that health and nature are intrinsic, and without going into great detail with the previous speakers, it's obvious, and the calibre of the people sitting here today and people in the room evidencing that body of evidence make sure that we do know that this is avoidable health costs are there from health and environment. Our colleagues in South Australia, New South Wales, New Zealand have also taken on that philosophy, and again mentioned earlier as a global movement and growing body of evidence. We're seeing that right across the globe, which is fantastic. If I can put it in context, about 100 million people come to Parks Victoria per year across our whole estate. Now, if you look at 50 million of those people are using our urban parks and national parks, and that's for recreation, cycling, and whether it's children right through to age demographics. About 45 million further are using our ports and jetties, it's fishing, boating, and again, recreation. I think to note more importantly, around 23 million people are coming per year for physical activity. So we believe that, and we've measured that anywhere between, at the low end, between 80 million or up to $200 million in avoided health costs per year are coming proactively from linking health and nature together. So the intrinsic marriage between those two is obvious to us in how we not only look after our community, whether that's international tourism, over 1.6 million people alone go to one of our national parks, the Great Ocean Road, per year. That's bringing international guests from China, or whether that's talking to our local community. It is clear that proactively health benefits mental and physical health, so we're delighted on those sort of outcomes. Further, we mentioned about children being a topic. Around 12 million visits per year bringing children into parks. So what a better thing for us to do to say, how do we make sure the obesity problems of children today, getting them off the Facebook, whether it's Twitter or Minecraft or whatever those TV screen games we have, is to really connect and get them back to nature. And we're very clear that advocacy from people respecting parks and using that for health become advocates of biodiversity and conservation moving forward. So we're building the future capital and respect out of our children to understand and value their park estates, which leads to biodiversity treasuring and also health and wellbeing. So partnering with collaborative interstate groups, like-minded organisations has really been a clear benefit for us.
Terrific, thank you so much. Now I want to move on to Kevin Lafferty, who's the National Policy Advisor for Access, Health and Recreation with the Forestry Commission in Scotland, which at the moment is still part of the United Kingdom. And now we come even closer to the ground, a practical voice from the conservation sphere. Kevin, I have to ask you, Scotland is infamous for not having the healthiest population. There's this idea of the fried Mars bar, which I'm reliably informed does exist. So tell us how the Forestry Commission has been partnering with NHS Health Scotland for the Green Exercise Partnership.
Yeah, to focus on a practical example of how we've seen a collaboration between, I suppose, the nature organisations and health at a country level is what I'm going to focus on. We set up a national task force in 2007 called the Green Exercise Partnership. It's a joint venture between Forestry Commission Scotland, Scottish Natural Heritage, and Health Scotland. That's the Health Improvement Board of the National Health Service. And the partnership was established to build these links between the health and environment sectors. And really, the aim was to build on the growing body of evidence that would demonstrate improved health by getting people engaged and actively out in the natural environment. So it's been running for 10 years. It's been a success story. And I want to just highlight on a practical basis, how does it work? Because we've had a lot of the strong endorsement and support, but really, what do we need to do when we go back to our own federal or state areas to actually make this difference? And on a practical level, the Green Exercise Partnership in Scotland consists of 8 key people nationally, 4 from the health sector and 4 from the environment sector, who meet on a bi-monthly basis to oversee policy and practice. We use a rotating chair so that it's shared ownership and shared responsibility, and each organisation contributes annually to a shared pot of core funding to fund programmes. So it's not just a talking shop, it's about delivering action on the ground and showing how we translate policy into practice. So the 3 key aims that partnership had was to establish a national collaboration across environment and health policy and practice. That organisation's been presenting and speaking at the National Public Health Conference in Scotland for the past 10 years. Our Chief Medical Officer endorses it. Our Directors of Public Health are engaged. And now it's seen as part and parcel of trying to transition from a national illness service to a national wellness service.
Yes. Yeah.
And what we really want to do is to live up to this aspiration of a health-promoting health service. It's not about treating illness, it's really about trying to take an upstream approach and to try and make sure we maximise the quality of life for as many people as possible. The second point was to have a practical project to show how we made a difference. So at a state level, we had the ambition of having one demonstration project in at least one hospital or healthcare facility across the country, and we transformed the green infrastructure around the hospitals and the healthcare facilities, and we encouraged good green space design, ability to walk and to cycle, ability to take treatment and recovery outdoors, so that staff and patients would benefit, and to try and normalise this. So that's a practical example that could be taken and used elsewhere. And as part of that, we set up a couple of firsts. We have health rangers in Scotland who actively work with the health professionals to take recovery and treatment outdoors. And then lastly, to champion the use of green exercise and to embed the use of the natural environment into the culture of health policy and practice. And to put it in context, in Scotland, 1/3 of all of the funding annually is spent on health, 12.5 billion, whereas we spend about 400 million on environment.
Yeah.
Now, even spending a small amount of that health budget on environment would deliver more substantial population health gains than it would if we continue just with a treatment and illness model. So we're asking for 1% of the health budget for green space. That's 1% of 12.5 billion. Now, what the environment sector could do with 1%, I would argue, could deliver far wider and far longer lasting public health benefits than the health service could do. So health is everybody's business, and the Green Exercise Partnership is about that. So that's the answer to the first question.
Yeah, and I'll move on there. But there were so many heads nodding on the platform. I think everybody was practically salivating at the idea of having 1% of that health budget. Okay.
Strongly.
Do you want to jump in?
Well, maybe if you allow me, I think we are saying the same thing, but for me, it's not taking 1% of the health budget to invest it on the environment. It's the other way around. Is by doing good investments on the environment, you can have a lot of percentage and benefit to the health sector and reduce the budget of the health sector. So probably we are saying the same, but it's not the health sector the one that needs to pay for environmental interventions. It's the health sector the one that needs to influence environmental interventions in other sectors that then will generate a lot of health. So,
Okay, so we'll note that particular note, and please feel free, panel, to come in on it. But I want to bring in Daniel Buss here now, who is the advisor on global environmental changes at the Pan American Health Organization. So like Kevin, he's also been a key leader in terms of building out links, in this case, between the Pan American Health Organization and the US National Park Service, which celebrated its centennial just last year. So can you tell us more about how that partnership has worked, and perhaps specifically how you're working with health providers, Daniel?
Great. First of all, I'd like to thank very much for the invitation. I'm a big fan of Parks Victoria work for a long time in this, as a global leader on Healthy Parks, Healthy People movement that inspired all of us, including this initiative that we share with U.S. National Park Service. But not only in the U.S., we also have officially engaged Parques Nacionales Naturales from Colombia and the Ministry of Health from Colombia, and the Corporación Nacional Forestal from Chile with their National Minister of Health as well. And the idea is to go more into the concrete stuff. So working with park managers to develop a tool to maximize the capacity of park services to promote health. That's our main goal with this initiative. And the reason that why we started developing this tool is, and I can focus my talk here in 4 background principles that guided us. So the first piece is that parks and green spaces can deliver numerous health benefits for people. I'm not going, I had prepared here a list of things, but many of them were already mentioned before, but on physical activities and reducing diabetes and promoting and reducing cardiovascular respiratory diseases, those spaces are crucial for mental health, like Dr. Maria Neira has mentioned, and spiritual health, which is also another dimension that we think it's worthy capturing in this tool. Helping reducing stress, being spaces full of cultural and historical information. So all those aspects that promote social interactions also are important for as one dimension that we want to capture in that. And also it increases social resilience, which are one of the key things for this global overcrowded world that we live in, with challenges promoted by climate change, and that's why we think that it's another thing that we should look for in the future. So jumping into a little bit more on the tool, another aspect that we also take into consideration is not only treating green spaces or parks, but also, like a president mentioned, on high biodiverse ecosystems can promote health. So green spaces are not unreactive spaces where people are going to interact. So if we can promote highly biodiverse ecosystems, we have a number of information, and the book that both Maria and Christina had mentioned, Connecting Global Priorities, Biodiversity and Human Health, a State of Knowledge Review that we published together, WHO and CBD 2 years ago, brings a lot of information on that. But I would like to add a few dimensions that is also a background on our tool. So not only the importance of green spaces and parks for health is important, but a second piece is that health is a human right. And I quote the WHO Constitution from 1948, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. Unfortunately, the third piece that drives us is that in a number of countries, it has been shown that the access to parks and green spaces are not equitable and universal. For example, some studies in the United States show that, in the state of California, show that Latinos, Black, and poor people has 2.5 less access to green spaces than white people, rich people that lives in wealthier neighborhoods. So the access to parks, so it's not enough to have a high biodiversity park if people are not getting there to have the health benefits from it. So by denying access to green spaces, we are failing in delivering the highest standards of health for all. So with all those topics in mind, the Healthy Parks tool is a way of assess and optimize a park's potential to promote health. That's our main goal. So for that, we need not only to grant universal access, including elders, children, people with mental and physical disabilities, the poor people, and considering all racial issues that are underlined into that. But not only that, but we need that park managers to promote programs, policies, and communication strategies to optimize physical, mental, spiritual, and social health. So that's a way of bridging these two worlds together. That's one of our intentions. And that should be occurring in a place that is safe and secure, clean, meaning with environmental sustainability, with all of its dimensions, and like I mentioned, with access for all. So in our tool, those are the 8 dimensions that we want to capture, and we are collecting a number of information on that. A number of people in this room are contributing to it. But we are also interested in analyzing the workers' health, so people that work in parks, so what are their conditions and what are their health-related aspects that are underlined into their own work. Mr. Matthew Jackson was mentioning that it's one very important thing under the Parks Victoria. So we look forward to interacting more and learning a little bit more on that and maybe being able to apply that in other countries as well. So to finish, our aim in this tool is that this tool could provide guidance and ideas for park managers, but also that health professionals should use it as part of their park prescription programs, which is a very interesting program that we hope to launch it in other countries in Latin America in the following year. And by using that tool, they will be able to identify the best park for each patient, taking into account their medical condition, the social condition, gender, age, etc. And this is an excellent opportunity to tackle the epidemics of NCDs, for example, or mental health issues. So we think that this Nature for All initiative would join and merge with the Health for All initiative that the WHO has also launched. So as closing remarks, I believe that the message is very clear, and I was really happy to be in IUCN Congress last year and be part of all this movement. But nature, with the highest levels of biodiversity, is a powerful, powerful way to deliver health to people. And I really hope that, these words inspire many of you to participate in that initiative with us, that we look forward to interact in the following months and collect as many information as we can to develop this tool together and bring more healthy parks and healthy people for all. Thank you.
Thanks, Daniel. So I'd like to turn back to Maria at this point and think about where WHO sees its future priorities, bearing in mind the climate change trajectories that we're all, or most of us, are only too familiar with. And in particular, because you said, let's think beyond the doom and gloom narrative, how do we look at those trends and risks, but really say what is the leverage and the potential of WHO as one of the leading organizations in this area?
Thank you. And I think at first we need to make sure that we are all aware of all the evidence that has been produced, because this is where our kind of institutional power remains. And in 1992, WHO produced a book called Our Planet, Our Health. We have different reports on health and environment. We have produced 2 reports already on the impact of the environment on human health, the latest one producing this terrible figure of 12.6 million deaths associated to that. And very recently, we have launched a report called Don't Pollute My Future, which will look at how the environmental risk factors were responsible for 1.7 million deaths every year on children under 5, because I think that the focusing on the target group of children, it was very, very strong. In 2005, we already produced a report on climate change and health, and actually we started in the 90s, but the resolution on climate change and health was approved by 194 ministers of health in 2005. We have resolutions on air pollution. We have roadmaps on air pollution. We have it on on chemical safety. We have it on biodiversity now, reports. So I think the evidence is now so heavy. We need to make sure that the alliance that have been existing for a while as well, because we have ministers of health and ministers of environment alliances in Africa, in Asia, in the Eastern Mediterranean region, and we are now creating a global one. So this alliance between health and environment is critically important. In Morocco at the COP, we were launching an appeal for bringing more groups and NGOs and associations and UN groups as well, and all of those who feel that health and environment are so strongly linked, and use it with all the political power that this can generate. Most of the basis for success, I think, will be on how we use all of this evidence and the political messages that we are creating with that, and the political opportunities by now putting a lot of pressure on the implementation of the Paris Agreement, recognizing that this is an opportunity to create action on health and environment, on generating more actions at the urban level with mayors and municipal authorities, and forcing them to think about this urban planning where they need to consider nature and green spaces and all of that, and how we can create alliance with the groups like today. For me, the power of this meeting today is that we are here at the World Congress of Public Health, and we are talking about environmental health. We need our own constituency, and I'm talking now to the public health people, to please be very much aware of those messages of the importance of primary prevention. And then primary prevention in medicine means exactly what you were saying, that instead of paying for treating our patients, which is very costly, and of course we want to do it, and we have to do it at the highest possible level without looking at the cost, but we need as well to apply the primary prevention principles, which is avoiding people to be exposed to the risk factors. And that can be done through this association with other organizations, passing as well positive messages. I think we need to empower people and say, okay, it can be done. Christina referred to our report very rightly. we are talking about modifiable environmental risk factors. And that word modifiable is key because we can modify those environmental risk factors. And I think it's a fantastic magic moment. The fact that we have a political environment with some politicians now challenging climate change, well, you know, sometimes, let's be positive, when you have something very aggressive to be proposed, maybe the groups against that will be very much united and create a stronger movement. Maybe I'm pathologically optimistic, but I am convinced that this gives us an opportunity to be more united and join our forces to, you know, try to convince and put some reason in other instances. So I think we have a fantastic agenda for nature, for public health, for children, for environment, for parks, and for conservation and for biodiversity. Is all the same agenda. For us, there is no health without all of the services that the nature has to provide. The human species will disappear, as simple as that. So let's move on this alliance. Please join this alliance that WHO will be publishing, and you are free to join, to subscribe, and I think this union can create an amazing, powerful force.
I salute that optimism, and I like the diplomacy. It reminded me of Harry Potter, you know, he who must not be named.
It's giving him too much publicity, so let's
exactly.
do it this way.
We're respecting the bargain. So you talked about mayors and the way in which locally driven action can really be powerful. And I want to bring in President Zhang at that point, because your country, China, is one of the biggest countries grappling with this problem of the air pollution that is impacting on health. Could you talk just briefly a little bit about what can be done from cities in order to bring the health and nature agenda together with the power of mayors and local government?
Thank you so much. It's really, when I come to Melbourne, to breathe the very fresh air, I see the difference. And every time I have a meeting in the Cologne, Geneva, I also see the difference. You know that my country, China, has a long tradition to respect nature. And about 2,500 years ago, it is Confucius, people know that, but also Laotius, that has the great philosophy, man and nature are integral parts, the harmonize. And also nature-based solution at that time. 2,600 years ago, he advocated that. And since reform and opening up started in 1978, China has already succeeded in eradicate 600 million of the poverty. So Secretary General Pan Ki-pong said that China itself helped to solve the #1 objective of MDG, poverty eradication. And China also grew so fast as a major factory to produce the quality and also economic products, so whole world benefit from that. But at the same time, China also, for this modernization, China have a different road opening for this modernization, now become second largest economy. But at the same time, it's also a huge cost. That is to say, for the relationship between development and conservation, pollution and also purifying that. It is follow the old road. So this very severe lesson. We can see that so many developing countries still that struggling for that, okay. And you mentioned very important city, how city has a special role. The IUCN thinks that also China, since I'm being the mayor for one of the top 5 cities for 2 terms elected, so I particularly think that how to engage local community, regional government like Victoria, and the city government. Here we see the Melbourne, right? And so China now set a very high standard for the governor and the mayors. Okay, by year of 2020, we will reach our 100-year dream for fundamentally, comprehensively achieve the petty well-off society for 1.3 billion of the population. What are the biggest challenge for that? We identify two. Number one is 100% eradicate of the poverty. Number two is the environment and the ecological system. So for city, I think that now has been given a very high regards so as to implement that. For instance, the city, now I live in the Beijing city. So 2 days ago, China announced that to integrate Beijing, Tianjin, and the Hebei province for integrated treatment for that, not only, to deal with immediate urgency, but pay much attention to nature and the ecosystem service, to restore the lake and also improve the catchment of the whole integrated system of the river and restore the forest and the wetland. So this is the one thing. The second is a city. We are now doing the smart city growth and the sustainable city. For instance, the sponge city, right? How to handling with the drought and also flooding. And the city also that is in a protected area. How to bring nature back to city, find a more green space. And this is another, major program. But more important, how to engage not only government, but also private sector to let them see biodiversity really work for them. Okay. And biodiversity fundamentally is as important, as critical as a climate change. Okay.
Absolutely.
So now we're working for the nature capital. Another organization, I'm a co-founder and executive chairman for Eco Forum Global and Eco Foundation Global. It's a premium platform in China, and we bring all the mayors together, not only China, Asia, but also globally, so that to share the best policy and experience, and let the people engage in the city. So those are the major ways, and the IUCN now, see how much importance to bring nature and health together. But most critical, still the political decision. So now I'm very happy to see that health sector, WHO, and also this Federation of Public Health, together with the environmental sector. But how to handle the piecemeal approach, silo approach. So very important to bring the financial sector together, to bring the economic sector together, to really have an integrated approach to see that nature will really benefit. Thank you.
Okay,
Yeah.
thank you. And Gerald, would you like to make a couple of comments on your interactions with the finance or economic sectors as the CEO of Vic Health?
Potentially. I'm also very aware of the time.
Well,
and so
I am too.
I also
Okay.
just will keep my comments really short so then you can wrap up and we can have the Deputy Secretary up onto the stage. So certainly for us, we know, and I think Maria's captured this really well as well in her speech, that partnerships are absolutely key to achieving health outcomes across sectors. And Vic Health is an organisation that works outside of the health sector. That's our remit. That's how we were founded. And so we do work with many, many different sectors in order to achieve our objectives. So that partnership piece is incredibly key for us. And we are working with some finance sectors actually on something that's not so much around the nature-based space, but certainly around the gender equality space. And that is something we're launching in a couple of weeks, so I can't really talk about it too much, but other than to say that Vic Health fundamentally believes in working in partnership, and to take Kevin as well, who said that he took up the challenge and said that he thinks that the health sector is probably, the biodiversity sector could do better than the health sector in terms of improving the health and well-being of all communities. I think that is very true potentially of the illness side of health as opposed to the health promotion and prevention side of health. And I think that's just an important distinction to make. But I will hand back to you so you can do your closing comments, Claire, and then we can ask the Deputy Secretariat.
Absolutely, and we are right up against the time limit. I just want to pick out just a very few things that, by way of synthesis from this great panel. We threw down the gauntlet of what, who, and how, and on the what, clearly the access to knowledge, being able to make a good evidence-based case is absolutely fundamental. And not all that evidence is available. Sometimes it's behind firewalls or it's fragmented. Another was making the case around avoidable costs, because we all know that a hard figure enables you sometimes to penetrate sectors that don't think this is their business. We got the great figure from Matthew over Parks Victoria about that $200 million of avoided costs, which is very powerful at the level of a sub-national territory. We talked about transforming hospital environments for those who work in them and for those who visit them, and about embedding green exercise into the very heart of the way that leisure, recreation, and urban policies are run. But we also talked about the needs of the people who work in the parks, not just the hospitals, and how they can be both innovative and practical, park rangers, health rangers, and so on. But all of this going to building the social resilience and cohesion, and understanding that it isn't only about the near city nature. The high biodiversity areas are fundamental to preserve opportunity and options for the future. Very briefly on the who, we can look at that at different levels. We heard briefly about the role of the clinician, the medical provider, in writing parks prescriptions. And I firmly reckon this is one to watch, because in Salzburg 2 weeks ago, the Nature for All movement picked on the parks prescription innovation to be taken and rolled out through the Nature for All movement. So I think this is one to watch. If we go higher up the food chain and we look, for example, at national levels, we heard the great example from Kevin of having true co-ownership between different departments of something that matters to the whole of society, even to the point of rotating the presidencies and co-creating the strategy. And higher still, Maria gave us the good example of the way that a global intergovernmental organization can be a champion, can project optimism about the new alliances that we need for the future. And lastly, how? I'm going to go back to that word optimism. If you don't have a vision, if you can't compel interest and attention, then, we'll keep on working, but we won't get the results in the time that we need. So the idea of national wellness systems or health-generating societies is very compelling. And we didn't have the chance to talk more on Matthew's good point about advocacy, but the need for good communication and thinking about the way that the media, for all the talk about fake news and alternative facts, could become much more effective and powerful allies for different target audiences is one that I think is interesting. And we scraped only the surface of the how when it comes to budgetary allocations, reallocations, and transfers. Clearly, the partnership with the private sector is absolutely fundamental in terms of how monetary flows to invest in preserving green space can really be secured. In the long run of things, that is very, very inexpensive for the return on those investments. So the political courage, which several of you hinted at or talked about openly, remains fundamental whenever it comes to the real financial flows in society. In closing, I would say that we also work very closely with the leaders of the world's financial sectors. And from this year, we are actually putting the Sustainable Development Goals as a discussion item when they first come to Salzburg. But even in the last 5 years, the change in the people these institutions and corporate boards are seeking to hire has moved dramatically in the direction of thinking about sustainability. So think about how we reach the boardroom, not as adversaries, but as agents of the same change that we would seek. With that, and before we welcome Paul Smith, please will you join me in thanking this exceptional panel who was so good.